Thank you for joining me for another episode of Keeping Up with the Pace. Today I am having a discussion with someone I'm very privileged to, Christopher Hall, CEO of Grief Australia. Chris, for nearly 2 decades, has served as the CEO of the Australian Centre for Grief and Bereavement, now called Grief Australia, the nation's government-funded specialist bereavement service. He's a psychologist with a deep expertise in grief and bereavement, with interest in child and adolescent health, complex bereavement, and organisational impact of grief and loss. His contributions to the field have been recognised both nationally and internationally. In 1999, he was elected to the International Work Group on Death, Dying and Bereavement, and later became the president of the Association for Death Education and Counselling, one of the world's oldest and most respected interdisciplinary organisations dedicated to dying, death and bereavement. He is a fellow of the Australian Institute of Management and an honorary fellow in the Department of Psychiatry and the University of Melbourne. Acknowledgements that reflect his impact in shaping grief practice and policy in Australia. Today, as I said earlier, I'm very privileged to welcome Chris onto this episode to discuss all things grief. So welcome, Chris.
Thanks, Timothy. It's great to be with you, and I look forward to our conversation together.
And I am very, very privileged. I've had Chris penciled in for quite a while. I was very fortunate to get to see him speak at the Oceanic Conference, and I'm glad that we were actually able to get to do this, Chris.
Well, I'm looking forward to the conversation, and yeah, it was a great conference. I enjoyed it immensely, and hopefully, what I've got to say might resonate with some of your listeners today.
I'm certain that will. And Chris, I just want to ask a question straight off the bat. Simply, what is grief?
Okay. We'll start with the easiest question first, perhaps, or not. But look, grief is our natural and inevitable human response to loss, especially the loss of somebody that we have an attachment or a connection or a deep love with. Grief is more than just an emotional response. It's more than a sadness. It's often a complex mix of emotions that might include sorrow, that might include a sense of yearning or longing for the person. It might include anger, confusion, a sense of numbness and unreality, and in some cases, a sense of relief or guilt. But grief affects us really in lots of different ways. It affects us physically. We know that grief affects our bodies. We often experience a depressed immune system. We can experience a whole range of other physical complaints. It's certainly true that people do die of broken hearts when we look at the cardiac risk events in people who've experienced profound bereavement. It affects us emotionally. It affects us socially. Many people express a sense of sadness or disappointment that people don't talk to them about their loss, or they don't remember together the person who died. But it also raises potentially large questions of meaning for people. And this could be of a spiritual nature. Where is my loved one now? But it also could raise big questions about meaning in general, about this is not the future that I had planned. And that for many bereaved people, it's a process of relearning the world. The world is a different place, that it's no longer inhabited by the person I love. But it's also about relearning the self, like, who am I now in the wake of this loss? And when somebody dies that we have a strong connection with, in a real sense, part of us dies as well, because the other person acts somewhat like a mirror. They reflect back parts to us of ourselves. They might be the only person that knew certain things about us. But what's really important is we've moved away from these kind of cookie cutter ideas that everybody's grief is the same, that in fact everybody's experience of grief is as unique as their fingerprint. It's shaped by their personality, it's shaped by their culture, it's shaped by their spiritual beliefs, it's shaped by their family system and the relationships they've had with the person who died. And I think particularly when someone dies, especially after a long illness like cancer, grief isn't just about what's ended, but it's also about the life that was lived, the dreams shared, the connections that remain. And so grief isn't one thing. And I think we've moved away also from the idea that people go through a kind of predictable emotional trajectory and they reach, a place of kind of acceptance. And I think in many ways, our grief changes over time, but we never get to a point where it's all done and dusted. Grief is powerful, and it has the capacity to come back and to be as fresh and perhaps raw as it ever was. So, as I said, it's rather than an idea of we kind of complete our grief, it's really a lifelong process of integrating this loss into a new way of living. Sorry, Tim, you're on mute.
Given it is so multidimensional, Chris,
Yeah.
what are the services that Grief Australia can provide, and what are the supports that are out there for these people, given it is such a dynamic
Yeah.
transitional time?
Well, I think it's really important to acknowledge that most people don't need any kind of formal intervention or grief counselling. We find probably about perhaps 30% of the population benefit from some support. And we find probably about 10% of bereaved people do benefit from kind of perhaps more comprehensive grief therapy. But for many people, they manage grief really through the connections with family and friends and others who knew the person who died. And so in terms of the supports we provide, they kind of vary depending on what the person's needs are. So for some people, it might be just a single conversation, a single session. It might be a reassurance. And in fact, the way they're managing their grief is very normal, very typical. For other people, it might be that they're struggling with making sense of the loss. And so we know there, particularly a group can be important, to be with other people who've had similar experiences of loss that share a kind of same kind of emotional language of grief can be helpful. And then a third group who perhaps benefit from more kind of individual support when their grief has really kind of something's derailed that very normal process of loss, something that's captured their attention that makes it difficult for them to process their grief. So the supports we provide are obviously face-to-face and a lot of telehealth. And in addition to that, we provide education and training for both members of the general public as well as people that are in the part of their role involves bereavement support. And the other is really about kind of research and the development of policy and advice to government and other organisations around the management of grief. I feel as a culture we don't do grief terribly well. I've often said that I feel like where we are in the grief and bereavement field is where the sex education movement was in the 1960s. You know, it's rich in euphemisms. We tend to talk indirectly about grief. We use euphemisms like, you know, passing away rather than perhaps saying that the person has died. It's something that sits on the boundary of being both public and private. And so sometimes there's an awkwardness about, you know, should I raise this or talk about this or not? And I think there's also a sense that the people often don't have the language to be able to talk about grief. There's often fears about saying the wrong thing or making it worse. And I think sometimes that paralyzes people. They feel that they'd rather not say anything at all rather than perhaps risking saying the wrong thing or making it worse. In many ways, we can't make it worse because the worst things happen for this person. And many people say that what they miss is the ability to hear the person's name of the person who's died and to share memories. So I think it's always I always encourage people to be brave and to raise those conversations, to be active in the way we support people. Yeah.
It's really interesting in what you said there, Chris, where there was three groups of people, one group that will need individualized therapy, but the other two groups, the healing really comes from either people that have a similar experience or their existing network that is around them. So very much the answer seems to be it isn't exclusion or putting things away or compartmentalizing this, it's actually embracing that.
Absolutely. Absolutely. And I think, you know, I often say a lot of good grief support or grief therapy is good grief education for people to understand the nature of grief, and that grief is a powerful emotion, that really, you know, grief and love are kind of companions here. That grief is often that expression of that loving connection that people have. Now, I also want to recognize that our relationships with living people can be complicated, and sometimes it might be love and a combination of other more complex feelings, or sometimes it might not be love at all. But this person is very much a part of our world. And so grief also has that complexity as well, because sometimes relationships are complicated. Maybe there is a sense of regret, or there's a sense of things wishing to be different. And so when I talk about the power of grief, it's really about that power of that connection, which in many cases is one of a loving connection, but not always.
Mm. You spoke on a little bit earlier there, Chris, some of the misconceptions around grief, and that there is not the wrong thing to say because the worst outcome has already happened to that person. But I want to try and understand what's the role of organizations in supporting team members as they're returning to work, if they have a bereavement or a period of grief. What's your advice to them?
Well, I guess to initially go back to that kind of question of kind of misunderstanding, I think there is still, and I've certainly seen in the 30 years I've been involved in leading the organisation, that there is still kind of there's growing awareness, but there's still a lot of significant misconceptions about grief in the Australian society. I think one of the most persistent is the belief that grief follows some kind of timeline, that there's a period of distress and then people kind of move on, they get over it. And we know that really 3 to 4 days after the death, social support starts to drop away. There's this idea that by the time you've defrosted the last casserole, thrown out the last bunch of flowers, that life kind of returns to normal. And that's kind of reflected, I think, at even at a cultural level, in terms of the ability for people to take leave following a significant bereavement. So, and for many people, the most difficult part of their grief is after those rituals, after the death has taken place, where the rest of the world seems to have moved on, but the grief hasn't. They're still living with a deep and ongoing sense of the absence of the person. So I think when workplaces, when communities, when systems minimize or rush grief, that the consequences are significant. People can feel isolated, they can feel unsupported, they can sometimes feel ashamed of their grief. And I think that we often see that in terms of people struggling at work. We see that sometimes in burnout, in fractured relationships. So I think when those systems don't acknowledge grief, it becomes what we call disenfranchised. The sense is that people don't feel that they're entitled to grief. So I think when we respond with compassion, when we respond with flexibility, and we respond with understanding, we kind of foster an environment where healing is possible and people feel seen in their pain. So talking about organizations, whether that's in healthcare or palliative care or cancer support, I think they carry a really critical responsibility, not just to support the dying, but to care for the living who grieve that loss. And workplaces are often one of the first places that people return. And it can feel jarring for some people to be surrounded by quote unquote normal life while carrying this kind of often invisible weight of loss. Under the Fair Work Act, we are entitled to 2 days compassionate leave following the death of a family member. That's a pretty strong cultural message that grief is seen somewhat like the flu, and the people rapidly return to normal. And I can understand why that feels quite surreal for bereaved people. I think sometimes managers often have very little training on how to support grieving people. There may be an implicit message about getting back to normal quickly, which is, I think, really kind of unrealistic and harmful. So I think there's a couple of things that workplaces can do. They can, first of all, offer extended or flexible leave policies, and also policies that are culturally appropriate. So having an understanding of what sorry business means, the cultural obligations that members of Aboriginal and Torres Strait Islander communities have, that this is not optional, that this is a deep obligation, that we increase and improve kind of grief literacy for managers and team leads, that they understand something of the nature of grief, creating a culture where talking about loss isn't taboo or difficult. I also encourage managers to do things like entering into a diary acknowledgement and to acknowledge significant dates, and that might be the anniversary of deaths and so forth. And certainly EAP is important. Having employee assistance programs is important, but in a sense, that's sort of not a get out of jail free card for organizations. We need to create workplaces that attend not just to the head, but also to the heart. It doesn't need to be perfect. And we might struggle to find or say the right thing, but it needs to be human. Simply listening, acknowledging, allowing space for grief can make a real difference. And people often remember the quality of those invitations rather than the words that are used. I often tell the story of a woman who I spoke to whose daughter died in the emergency department of a large public hospital, and she said, I had lots of people come through my life on that day. I had intensive care specialists, and there were somebody from social work, and there was somebody from pastoral care, and they talked a lot. They gave me lots of information, and I'm sure they tried to be reassuring. But she said, when I think about that day, what I remember is a nurse with red curly hair who came up to me, and she passed me a cup of tea that I hadn't asked for. And as she did that, she just gently squeezed my hand, and our eyes met. So nothing was said, but for her, what stood by or with her was this quality of care, that this person was in that very human moment. There was just a sense of connection. And so sometimes, the thing to say is, I don't know what to say. And it's often Walter Mikak, a name that be familiar with many. Walter's a patron of Grief Australia, and of course his two daughters and wife were murdered at Port Arthur. And he talked about going back to the town where he worked as a pharmacist and seeing in the street the coach, I think it was of one of his daughter's soccer teams, and their eyes met, but the coach then turned around and started to walk. And so Walter thought, well, this is, I either do this now or not at all. So he started walking after this man, and this man started to walk more quickly, and Walter walked more quickly and caught up to him and gently placed his hands on his shoulders and turned him around. And the tears were streaming down this man's face. And he said, look, I'm sorry, Walt. I just didn't know what to say. And Walter said, it's okay. The worst things happen, but we can talk about it. And so when we want bereaved people to have this sort of support, to have the presence of others, simply being available is important. Again, I think of a dad whose daughter died in tragic circumstances. He said, I used to say to people who were bereaved, if you need anything, let me know. And he said, I don't do that anymore. I take myself. I don't wait for the bereaved person to ask for support. I take myself. I'm proactive, and I think that's kind of an interesting kind of position to take. That we simply as a human being connect with this person and their experience. Our job isn't to fix it at all, but simply to acknowledge that reality and to be present with people.
I really like that, leading with their actions.
Yeah.
And one of the things that Grief Australia wants to achieve is this grief-literate nation. What is that?
Well, I think a grief-literate Australia would be a country that understands, accepts, and supports grief as a normal part of life. And so I think in practice that means teachers who are trying to support bereaved kids at school. Perhaps school curriculums where we actually talk about the lifestyle of the butterfly, and the picture doesn't finish with this butterfly with outstretched arms. So we actually also talk about death as part of life, and even very young children who experiences the death of a pet. I think GPs and nurses who are asking the right questions, who approach bereaved people with a sense of curiosity. Teach me what this experience has been like for you. To be curious, to invite conversations which allow people to tell the story of not just loss, but also of love and life as well. we touched upon this earlier, but I think workplaces with really clear and compassionate policies that recognise that grief is part of life, and I think also for communities that keep showing up long after the casseroles stop coming, and realise that death ends a life, but it doesn't end a relationship. Even though somebody is out of sight, they're not out of mind or heart, and that grief is often about moving from a relationship where somebody is physically present and available to us to a relationship of memory. Grief isn't about saying goodbye and letting go. Grief is about moving from a relationship of physical presence to one of memory, and that many people will maintain that connection, and that's certainly not in any way kind of pathological. It's very, very typical. And so that we get over this idea that grief is about saying goodbye and letting go. I think it's also, a grief literate Australia is also about the language we use. Imagine a country where people would say, tell me about Peter, tell me about them, instead of, think of the good times, or you'll feel better soon, or although your husband's dead, you've got three, wonderful grown-up children that can support you. A country where people don't have a fear of saying the wrong thing, a fear that often leads the bereaved person to feel alone and to feel isolated and to feel they can't take their grief anywhere. So, I mean, I guess to me that's a grief literate nation where there isn't anxiety about these conversations, and I think that's absolutely possible to have a world where grief is seen as part of life.
Are there any countries that do it particularly well?
Yeah, I'm often asked the question, is there a kind of a cultural gold standard? But I think in many ways, I think Australia has been at the forefront of the area of this field of kind of compassionate communities, seeing grief not just as a kind of as a medical or a psychological condition, but really a reflection of connection and social connection. Things like death cafes, where people come together and they talk about death and eat cake, that are trying to remove these sort of prohibitions or inhibitions, at least, in talking about death. So I think Australia is kind of, punching above its weight in that regard. But I think all cultures, to some extent, struggle with this idea of kind of particularly grief literacy. I think there are perhaps some cultures where death and perhaps there are greater rituals around death. And there's less distance, if you like, that's being placed between the individual and the death process, where in the cultures, the idea of the body being at home and being washed and cared for, of sitting vigil, of not necessarily paying other people to undertake that work on their behalf. But I think this is something that is part of the human condition, that we don't like to think about death. We don't want to think about our own mortality, the fact that we will die and that everyone that we love or have a connection with will die as well. So I think it's a very much a hardwired part of the human condition, in terms of many people have this idea of an unending supply of tomorrows. We just need to look at the challenges in getting people to do things like advanced care directives, or even to make a will. We kind of don't want to go there in our head. And so I think it's part of the human condition that there's this, at some level, this sort of denial of death.
And what are some of the emerging trends you've seen across Australia?
Well, I think grief in Australia is certainly evolving, and I think we're seeing new forms of expression, but I think also we're seeing new layers of complexity as well. I think one of the trends we're seeing at the moment is a rise in digital grieving, that many people are turning to social media to share memories and to express their pain or connect with others who get it. And so those platforms can foster connection. We're also seeing some concerning signs around the use of AI and the idea of digital representations of the deceased, and using social media histories and photographs to create, particularly through generative AI, representations of the deceased. And I think that's complex, and we don't have enough kind of evidence about the harms or the benefits of that. We're also seeing increasing focus around what we might call ambiguous losses. This might be where somebody is physically present but psychologically absent. And so dementia would be one example here, or even the grief of a missing person would be another example where somebody is physically absent, but psychologically present as well. We're also seeing some emerging trends around grief following voluntary assisted dying, which can often be layered with some sort of moral and emotional complexity. And I think some of that is perhaps to be anticipated just through bereavement, but there seems to be some elements of that where voluntary assisted dying has some unique features of loss. I think we're also seeing a lot of work, particularly in Australia, around the grief of carers after long periods of anticipatory loss. The fact that many people are starting their bereavement journey physically and emotionally exhausted because of the level of care that they've been providing. And so I think carers are often an increasingly vulnerable bereaved group. And I guess to extend it beyond our kind of current conversation would be the application of grief beyond death to include what's now being called ecological grief, the grief around the natural environment and ecology, the grief of cultural loss and dispossession, increasingly, particularly out of the US, and growing interest in political grief, when losses are shaped by political decisions or injustice. So I think there, some of the kind of emerging ideas, and I think also the idea of more trauma-informed approaches in our understanding of the complex experiences of people. And I think in cancer and palliative care context, grief that occurs long before the death, with diagnosis, with decline, with perhaps the dashed plans and hopes of the future. I think there is more openness around our conversations with grief. There's a greater recognition of diversity, and particularly an understanding of cultural differences. So I think, yes, it's more visible. I think grief is more diverse and perhaps more layered than before. And certainly the things I used to teach 30 years ago, I certainly wouldn't teach now. That it's a really exciting field because our evidence base is so much better. We know in terms of interventions that they're effective, and that I think is kind of really exciting. Yeah.
Very interesting things you just spoke about there, Chris. I actually have an upcoming episode with an OT who is using AI for a client who has MND, motor neuron disease, and is using voice banking for when this person's degenerative disease progresses and they are no longer able to use their voice to be able to gesture to enunciate things as they would have done previously. But there's the whole issue of what happens once that person is bereaved and you have all of this data and evidence of this person. I want to get back to what is the responsibility around the banking, the AI, the profiles that exist of these people that have been bereaved. Where does that lie? Who's that responsibility with?
It's really interesting because when we look at some of these sort of innovations, particularly the use of AI and generative AI, it's as though the technology is moving much faster than either the kind of clinical perspective or the ethical perspective as well. And so there's a real question around digital legacy and ownership, and what kind of legal status does a deceased person have. And so and there seems to be very little. So Yeah, and I think when we talk about sort of AI, it can range from somebody opening up ChatGPT, as we have some of our clients do, and asking a question like, how do I explain to my 9-year-old daughter that her mum has a life-limiting condition? And I must say, uh, increasingly the quality of that data is getting better and better all the time. And so that's at one end. And then you've got the construction or fabrication of somebody who's died using data. And the problem with generative AI is that AI wants to please. It wants to provide answers. And often when the generative AI is creating a reality, that becomes problematic. Now, we would often, in a counseling situation, in some instances, encourage somebody to have a conversation with somebody who's died, what might be referred to as empty chair work, and then to lend their voice to the deceased and to kind of close that conversational loop. But that's very much kind of a managed experience, whereas with some of the generative AI, uh, it's a bit more challenging. And so I think I know there's certainly some work being done by the International Workgroup on Death, Dying, Bereavement to create some frameworks for the use of AI. But you can currently get an AI representation of a deceased person generated very, very inexpensively. So it's a fascinating idea, but it's fraught in many ways, particularly around the ownership of data. And these systems being locked away through subscription models. But there's a lot we don't know.
And from an education perspective, how do you, and workshop and counseling support perspective, how do you keep up with these such rapid, such complicated arrangements in supporting?
Yeah, well, certainly there's a lot of literature, not just in the grief journals, but more broadly in terms of the psychotherapy literature that talks about the use of these kind of new technologies. But I think we respond to evolving needs really through a combination of deep listening to clients and people who are providing support, through developing resources and guidance, and through education. And so I think we listen actively to bereaved people. We listen to carers about their experience. I think listen carefully to the experience of First Nations communities in terms of their own cultural practices and needs. And then there are particular cohorts of people who are grieving perhaps particular forms of death through perhaps suicide or more medical complex deaths. So again, on the basis of that listen, we then sort of look at designing tailored resources. Again, moving away from the one size fits all, but nuanced guides that reflect kind of the cultural and relational differences in grief. And again, we also develop education and training so that health professionals, palliative care teams, community organizations have a level of confidence in being able to respond to a full range of experiences. So again, next year we're delivering postgraduate training for bereavement practitioners and certificate level qualifications as a way of kind of building capability. Again, and we also kind of advocate. I think a lot of good grief support is also about political change. For grief to be embedded in palliative care services, in mental health frameworks, that the experience of grief is acknowledged within social systems and political systems. I think it's crazy that the Fair Work Act should say that we should get 2 days leave following the death of a family member. It's to me, it's just so out of step with the experience that people have.
From your perspective, Chris, what does quality grief support look like?
Um, it well, it feels like being seen, being heard. Um, uh, Quality grief support isn't about giving advice; it's about giving presence. it looks like somebody remembering the name of the person who died, um, a person who lets you experience a range of emotions, as that might be tears or anger, or simply to sit in silence. I always encourage people that, slow down, give people a chance to talk. Being part of a group where no one's there trying to fix you, but simply is able to be with you. For us, yes, we measure success in terms of clinical outcomes like reduced stress and so forth. But I think we also measure it in human terms, with people saying things like, I don't feel alone anymore, or I can talk about the person that I love who's died and I can now smile. I can remember them in perhaps a more balanced way. People who say, I don't think that I thought that this experience could have killed me. I didn't think that I could survive this, but I now know that I can. And I think that's the difference that support makes, that simply to be present with somebody and taking the position of, teach me what this experience is like for you, to be curious. And we might know something about cultural practices, and we might know something about, religious or spiritual beliefs, but, everybody is quite idiosyncratic in terms of both the relationship that they had with the person who died, what their experience is, what their resources are. But I think also it's about the bereaved person being their own best friend. I think sometimes bereaved people can be very critical of their grief. I should be doing better than this, or comparing their grief to other people. And so sometimes I think that we encourage people to be a good friend to themselves, and to acknowledge that love is a powerful emotion, as is grief, and we wouldn't expect it to be any different than that.
Yeah, beautifully said. I was just reflecting on the early example you gave of the person who experienced a bereavement of their daughter and were in an
Mm.
emergency department, and they had the whole range of services that came in that we would give that responsibility of, but then it was the small gesture from the nurse that was the authentic connection and what stayed with her. I was just thinking, I used to manage a large aged care home, Chris, and one of my shortcomings is that once we had a bereavement in the home, it would often be the severing of ties that we had with that family, even though we spent so much time getting to know the resident, getting to know the family. It's a breakdown that hopefully people that are in positions in residential aged care can go, oh, let's continue that connection. Let's maintain that even after there has been a bereavement, not just for the betterment of the staff, but for the family.
Yeah, yeah. Well, I think that's true, and I think the places where people die are often important too. I mean, my dad died. He had dementia for a number of years. Died in an aged care facility, and yeah, that was the last. I mean, I was present when he took his last breath, and it was a significant place because that's where, in a sense, his physical body kind of, ended. And to be able to go back and reconnect with staff who were an important part of his life and our life was an important thing. And also to hear the recollections and memories of staff, because they also were bereaved as well. And yes, it's part of their job, and it's certainly not unexpected, but they're part of a community where they too had relationships and connections. So yeah, I think it's and they had a lovely kind of memorial events and rituals where people were remembered. But yeah, it's often, again, it's often the little things, and it might be that note that comes, on the first anniversary that says, I remember, we remember, that might, share an experience. It's often said that we die twice. We die for the first time when our body stops functioning, but we die for a second and final time when our name is uttered for the last time. And so that sense that we keep somebody alive in our memory and also through the shared stories of other people.
We've spoken about, I guess, some of the responsibilities of work, of Fair Work, or the changes you'd like to have seen.
Yeah.
But what is the role in government in supporting grief and bereavement policy?
Yeah, look, I think government must recognise grief as a public health priority, one that touches every household, every community. Often I think there's a focus in government when there are particular significant or high-profile events, often that involve multiple fatalities, that captures the public attention. So I think it would be lovely for government to take a more proactive rather than a reactive approach to grief. I think expanding bereavement leave to reflect the reality of grief, especially after a long illness or a traumatic death. We see some countries, particularly UK, that have made great advances in acknowledging the impact of the death of a child, and formalising some of the leave and support provisions there. I think certainly investing in equitable access to grief services, particularly for people in regional and remote Australia, is there's still a lot of work to be done. And I think also training frontline workers. I mean, my view in an organisation that everybody is in the business of providing bereavement support, from the person who might be the receptionist answering the phone, through to, as I mentioned earlier, teachers, that people are able to respond with sensitivity, with a sense of confidence and competence. I think integrating grief support into cancer and palliative care pathways, not as an afterthought, but as a core component of care. I often look at websites of organisations to see, well, to what extent is bereavement part of the narrative? To what extent are there resources available? And particularly if it's a particular kind of disease or condition, to what extent does the organisation convey that, yes, this is something we can talk about, we're comfortable to talk about? I think sadly within palliative care, often bereavement services are the first to be cut when times get tough. And there's a lack of appreciation of bereavement support as a preventative intervention or a preventative strategy, in terms of supporting families. So I think currently grief support too often falls through the cracks. It falls between mental health, palliative care, community services, and so I think we need policies and leadership that weaves those systems together. It needs to be seen and also funded as a public health issue.
I wholeheartedly agree with the
Yeah.
frontline workers. We survey everyone that we educate, and the responses are always, we want more education, more training in grief and bereavement.
Yeah. Yeah.
So after nearly 30 years in this field, what changes have you witnessed, and what makes you hopeful for the future, Chris?
Yeah. Oh, great question. Well, I think over the last 30 years, the landscape of grief support has undergone a sort of a profound transformation. And when I think of when I started with, well, it was then the Centre for Grief Education back in 1997, we've come a long way, not only in terms of understanding around theory and practice, but I think also in terms of seeing grief as a kind of a human experience. As I said, there are things I would have taught 30 years ago that I certainly don't teach about now. So our understanding of grief is deepened. We have a far more nuanced approach to understanding some of the complexities and the resiliency that people have. So we draw from more robust evidence base about not just what works, but who it works for and for why. Again, we've moved away from this, as I said earlier, this cookie cutter approach and embraced its complexity. But I think importantly, grief is now kind of coming out of hiding, where it was once spoken about in kind of hushed tones, confined to kind of private conversations or perhaps medicalized language. It's now part of kind of broader cultural conversations. You just need to look at grief as a theme within, mainstream media and movies. So we see it through storytelling, through media, through art, through social media, that people are sharing their losses. And I think others are listening. So again, grief, although there's still a lot of work to be done, it's no longer seen as a solitary experience that happens just in the head and heart of a single individual. We're understanding it's a communal act of remembrance, where we're looking at families who remember and make meaning together. That we see grief as love continuing rather than something that we need to get over. We're seeing grief less as kind of the enemy, but as sort of a partner. I think we are seeing improvements in terms of more grief-inclusive policy and acknowledgement. But I think what perhaps gives me the greatest sense of hope and what sustains me really is the people. It's nurses, social workers, it's volunteers, it's counsellors that I've met throughout Australia who really work tirelessly in rural towns and cities and hold space for grief every day. They're often ordinary Australians doing extraordinary work, and they remind me that where death is inevitable, compassion is a choice, and we keep choosing it. So I think when we support each other in grief, we honour really what it means to be human, and I think that as a country we're learning to do that better. There's more work to be done, but again, the path ahead is not just by knowledge and kind of research and evidence, but by kindness, by courage, and the collective will to do better, by and for each other. A recognition that grief is not the opposite of love, it's part of love. And then when we care for grief as a community, as a country, we really care for what makes us most human. And so I think that's what gives me all the hope I need, really, to see people who go to the difficult places and are able to sit with people without the desire to fix it, but to trust people in the process. That if we, create a space for people to be able to talk about their love and also their grief, then that's what makes a difference. And I love the old Yiddish expression, which I've used for well over 30 years, that God gave us 2 ears and 1 mouth, and we should use them in those proportions. It's really about our capacity to be with, to listen, and to resist the urge to fix it, to make it better, or even to say words that might be seen as words of comfort, that we approach people with a sense of curiosity, that we want to hear the story and what's important to them. And as people tell that story, the story changes, and that they find a place for that story in their head and their heart. And so you don't need to be a psychologist or a social worker. You just need to be human, and to create an opportunity for people to talk about things that are important to them. And as they talk, we acknowledge their experience, and we acknowledge the pain, but we also often acknowledge the laughter and the humor and the memories that they keep alive. So in a fundamental sense, both my parents have died. I'll continue to grieve their loss until I die. There won't be a point where they're not part of my memory or even my recollection or kind of reflection. So, it's a continuation of a story, not the end of it.
Thank you so much for your time, Chris.
Thanks, Tim. It's been great to speak to you.
You too.